Good afternoon. I'm Miriam Cartmel, the Network Executive Director for Women's and Children's Services here at Kettering Health. And I would like to welcome you this afternoon to our virtual baby fair. Over the next hour or so, we are going to explore several topics of interest to you. So let's start with getting acquainted. A little bit about us. We have gyn services for the women's health at all campuses, and we have delivering services at 4 campuses located in Kettering. Soin is in Beaver Creek, Southview is in Washington Township, and Fort Hamilton Hospital down in Butler County. A little bit of what we offer is a full range of childbirth education classes. We also have services such as midwifery at the Soin campus, high-risk services with maternal fetal medicine should your pregnancy have any problems or you just want to be checked out further, or your doctor may recommend that you have a consult. In our labor and delivery units, many units have a labor tub. Some campuses offer nitrous analgesia. We have fetal monitoring so that you may still get up and move around. Postpartum care on the mother-baby areas, lactation support for inpatient and outpatient, and you will hear much more about that as the presentation goes on. Our neonatal care is provided by Cincinnati Children's Hospital Medical Center and is a great partnership for us, allowing us to have high-tech situations that still encourage family touch with skin to skin, as you see in the pictures above. We want you and your baby to get to know each other, whether you are on the mother-baby unit or the baby is in the intensive care unit. We also offer reproductive medicine and gynecological medicine. Childbirth education is offered in a variety of platforms, and Michelle is going to speak with you later about how that works and how you can register for these classes. We also have maternity tours by Zoom. Right now we are not providing campus in-person tours. So this is our alternative way to get you to see what is available on each campus and what that looks like. Why we do what we do. This is at the heart of everything we do, taking care of moms and babies. Thank you for joining us. I'd like to welcome our first presenter, Michelle Beebe. She will be speaking about our network childbirth education programs.
Good afternoon. My name is Michelle Beebe, and I'm the manager for perinatal outreach and childbirth education for the Kettering Health Network. And I have the privilege of working with families to help them have the confidence to celebrate one of the most sacred times of life. And part of that is by coming to childbirth education classes or events, and we have them both online or in person. One of the delightful things of the in-person education is that we get to talk with you, answer your questions, and are able to instill confidence in you. I know that you can find things all over the internet, but it is nice to actually be able to look at evidence-based information with people that have experience and are able to answer your questions in live time. Now, I'm going to try to see if I can move my slide forward. So, one of the things that we do with our classes is we give you information and we try to demystify the birth process. We have classes for moms and dads and grandparents. 4 campuses are where we teach: Kettering Medical Center, Fort Hamilton Hospital, Soin Medical Center, and Southview Medical Center, which you may find on some of our newer literature is being changed to Washington Township. So maybe by the time you deliver, it will be Kettering Health, Washington Township. One of the nice things about having 4 places you can take classes is that we offer the same information at these different locations. And You can swap it out. You don't have to take classes at one place or another. You can do what fits your schedule, which is something that I really enjoy for clients. The same instructors teach at the same places. So it's not like, oh, if I just go to Kettering, I will get something different than at Sewing. No, it's the same product on all of our campus, and we're delightful to be able to do that. So how do you register? Well, there's two different ways to do it. You can call us at 937-395-8600, and that's a lot to remember. Times we think we know because we babysat, or nurses, we've taken care of babies, but all of a sudden we're a mom. We don't get a shift break after 24 hours. Baby care takes us through that first 6 weeks. What to expect? What do I do if I have a problem? How do I change that diaper? Baby's crying. What do I do now? So we love to walk you through that. Breastfeeding class. It sounds like, oh, it's natural. I should be able to do it. But many of us will tell you the journey has a lot more than just natural, and we need support. So we're going to talk you through what to do, where to get support, and my colleagues are going to talk a little bit more about the lactation services we have in the Kettering Health Network. We have two options for infant CPR and safety, an online version and a live version. We want to make sure you have the confidence, what to do in an emergency, how to keep my home safe. Grandparents class. It is not how to parent as a grandparent. What it is talking through what we do now compared to what we did 10, 15, 20, 30 years ago. Grandparents offer valuable resources to new moms, and we want to validate their experience, but yet let them know what we're doing now and why, so they're all on the same team with you. We offer sibling classes, although right now it's been on hold due to our safety restrictions, and we are always trying to make sure that our families are safe. So our tours, I'm going to talk about a little bit later in the presentation today, but they are customized for you. Thank you.
Hello. So we've come to one of our first drawings of the event. Yes, we do have prizes to give away as well. And I would like to thank the sponsors from Goldfish Swim School that they have provided a $110 gift certificate. So I'd like to ask you to put into the chat of everything that we've talked about so far, is there one thing? Our next presenter is Melody Worley, and she is going to talk about some tips for financial planning.
Hi, I'm Melody Worley. I'm one of the financial counselors for the network. My job is to make sure that after you have a very great delivery, that if you have any financial issues, we're there to help you. So if you have issues about your insurance company, your doctors, things that may be in network or out of network, we're there to help you through that process. My phone number should be listed in the on our website. If you go to ketteringhealth.org, look for financial counselors, and you'll find our phone number. Our number is area code 937-914-7680. We'll help you, like I said, with any insurance issues. So, if you have something like maybe this doctor's not covered, or your insurance says they're not going to cover it, we have a way to try and help you through that. We will be happy to discuss it, anything you may have, any questions of that nature. It is very big charge to have a baby, especially if the baby's in the NICU, and if that happens, there's several options. The most important thing is after you deliver is that you have your baby added to your insurance plan. Then that will ease your financial worries right away. That's the biggest thing. Just make sure the baby's added. I can't think of anything else to cover, but we have several programs. There's plenty of us to talk to you, as she says. We have one central line, which is the number that I gave you. The most important thing is that you have a safe delivery and worry about everything afterwards. All those things can be addressed in the end. Whatever the financial issues are, we're there to help you. There's always someone there to help you. Thank you.
Thank you, Melody. I really want to reinforce what Melody said about making sure that your newborn is added to your insurance plan. That is really important to do right away. Yes, right in the hospital, you can do that. So we have another giveaway. Okay, this one is a basket from Discovery Toys. So this time the question for you is a financial question that you would like to ask of us, and then whoever wins the basket, we will try to also get you that answer. Okay, type in the chat. I should have a music for waiting. Again, the winner will receive an email or mail if you've registered. They're looking for all your chat answers to see who was first.
Kaylin Moose.
Moose?
Moose. I think that's right.
Moose. Kaylin Moose. You probably know who you are. Okay, Kaylin, congratulations. And we'll also get the answer to your question as we move forward. All right, our next topic is lactation care. Some of you may just know it as breastfeeding, and we have some breastfeeding consultants who are going to be here to help you today. So I'll have Michelle Nagy and Katie Boyd come on up and talk with you.
Good afternoon, I'm Michelle,
Hello, my name is Katie Boyd.
and we're going to talk to you this afternoon about our lactation services here at Kettering Health. So we wanted to start by describing what the best gold standard is for lactation assistance, and that person is called an International Board Certified Lactation Consultant, or you may see the initials IBCLC. Here at Kettering Health, we want you to know that our lactation consultants are both registered nurses and they have the certification as an IBCLC. So you get nursing care and lactation care at the same time. As you heard Michelle speak a little bit, we do have some prenatal services. We offer a prenatal breastfeeding class, and that's offered several times each month, and you can sign up for that online. You may also benefit from a prenatal breastfeeding consultation, and that would be, again, with an RN IBCLC at the First Steps Breastfeeding Support Center. And Katie's going to talk more about that in just a little bit. For interpartum care, first of all, each one of our nurses has attended a 20-hour lactation training program, and they are qualified to help you on your breastfeeding journey, so don't be afraid to ask the nurses questions. You will see a lactation consultant following your delivery and upon request. An IBCLC is particularly qualified to help with the more complex lactation challenges.
Hello, again, I'm Katie Boyd, and I work at First Steps, which is the outpatient breastfeeding support center for Kettering Health Network. Kettering Health provides post-discharge lactation support through our First Steps Breastfeeding Support Center. First Steps is located on the Southview Hospital campus in the Medical Arts Center building, which is at 1989 Miamisburg Centerville Road. We provide one-on-one lactation consultation visits, which include us communicating with both your obstetrician and your baby's pediatrician regarding the outcome of the visit. We provide phone assistance. The IBCLCs are often with patients, so the answering machine may pick up when you call us, but we really want to talk to you, so please feel free to leave a message, and your call will be returned as soon as we're available. We have a room located at First Steps. When you first come in the front door, it is a little room to the right with a scale. You're welcome to come in Monday through Friday from 8 to 4 and weigh your baby. Those weight checks are free. The one-on-one consultations are billed to your insurance company. We do recommend that you check with your insurance company prior to delivery to check all your coverage. You can see if breast pumps are covered, lactation consults, often breastfeeding support items such as bras and bottles and equipment to return to work. So it can be helpful to find out that information prior to your delivery so that you're prepared. We also have a breastfeeding support group called Connect, and we were offering that pre-COVID on Tuesday mornings from 10 to 11 a.m., and we are now in the process of preparing to resume that with safety precautions. So stay tuned to find out when that resumes once we're all ready to get that started again. We also have a breastfeeding supply shop, and we sell breastfeeding equipment, including bra fitting. We have a lot of involvement in the community. We work closely with organizations to help you continue your breastfeeding journey throughout the whole process. All the care is not just when you're in the hospital. You are welcome to come back anytime during your breastfeeding journey, and we will try to help you, and we will work with other organizations in the community such as Help Me Grow, MVCDC, WIC. Kettering Health promotes breastfeeding by providing education, support, and encouragement at the Mama's Market on Tuesdays at the Gym City Market. Please feel free to put questions in the chat, and we will answer them following the presentation. You may also call us at First Steps at 937-401-6881 to speak with one of us at First Steps. Thank you.
Hello again. So the questions in the chat for the lactation consultants to answer are not the questions for the next giveaway. We're going to do that now, and related to that topic, we have a gift certificate for 2 lactation cookies from Ella Bella. So here's your question. The lactation consultants are international board certified lactation consultants. Are they also nurses? Yes or no? Easy one to type in. And then we'll see who gets there first. At least we still get to give prizes away, even though we're virtual. Okay, I hope I say this right, Andrea. All Andreas, listen up. Andrea Stringer. Andrea Stringer. Okay. All right. Next up, you're going to hear from the manager of our neonatal intensive care unit and from one of our neonatologists. So I will have them come up, introduce themselves, and tell you about those services.
Hi, I'm Jenny Dalton, and I'm the clinical nurse manager for our neonatal intensive care unit. And I'm so excited today to introduce you to our special care nurseries and NICU services. No matter which campus you deliver at, we are ready for your baby. Whether they're born premature, whether it's anticipated or unanticipated, or whether your baby just needs a little extra TLC and care after their delivery, we are ready. At each of our 4 campuses, though your baby may be in the special care nursery or NICU, those units are located in close proximity to mother-baby unit where you will be recovering, so you can spend as much time as possible with your baby. When your baby is being taken care of by one of our special care nursery teams or the NICU team, they're experts in neonatal nursing, respiratory therapy, occupational speech and physical therapy. We have a NICU dietitian, and of course, IBCLCs that are specifically trained for the NICU and special care nursery setting. Though you may be, unanticipated to go into the NICU or special care nursery, we want to make sure that we're still supporting your family goals. And that may look like skin-to-skin holding, providing breast milk to your baby, direct breastfeeding your baby. And those are all still goals that our NICU teams are going to support you and your family in. One of the hardest jobs in the NICU and the special care nurseries, I always say, is that of the mother. So we make sure that moms, dads, support, family members are all a key piece of our care team. And one of our most exciting endeavors is that we have specific baby doctors, neonatologists, who see each and every one of our patients in our special care nurseries and at the Kettering NICU. And they provide world-class care. And that partnership is provided through Cincinnati Children's Hospital Medical Center. So it's with great honor that I introduce one of my highly esteemed physician colleagues, and I'm very excited to introduce Dr. Crystal Hill.
Hi, I'm Crystal Hill, and I'm a neonatologist at Cincinnati Children's Hospital. Our team of neonatologists and pediatricians partner with the Kettering Health Network to care for our most vulnerable patients. And if your baby needs specialized or intensive care at or after birth, we're here for you. We are the baby doctors, as Ginny says, who hope to ensure that we meet your family's needs starting at the time of delivery, if it leads to an admission to one of our special care nurseries or the neonatal intensive care unit at Kettering Medical Center. Just as reported by Ginny, our goal is to provide the best newborn care, whether your baby is born prematurely or ill. At Kettering Medical Center in our Level 3 NICU, our team of Cincinnati Children's neonatologists are available at any time during the day or night, that's 24/7, to be present at the birth of your baby or to participate in the intensive care that your baby may need. Our vast team of attending neonatologists, nurse practitioners, charge nurses, bedside nurses, clinical pharmacists, dietitians, respiratory therapists, and developmental therapists are available to answer your questions during patient-centered rounds. Rounds occur each day in the morning, offering an opportunity for the team to develop plans not only for that day, but sometimes for weeks to come. We have specialized NICU lactation support, as has already been mentioned, that work with mothers at that baby's bedside in our individual rooms. Though mother's human milk is the best if needed, donor milk is also available, and it's utilized for our most premature babies. Babies born very prematurely may require a very long stay in our NICU. For this special group of babies, our goal is to meet with your family at discharge, as discharge approaches, so that we can answer your questions and prepare you for taking your baby home. Your baby may benefit from our continued specialized care in one of our follow-up clinics or need to see a specialty doctor. Our wonderful discharge planner will assist you in every way possible to ensure that this time can be less stressful and that you are well informed. If your baby is born prematurely or ill, but big enough and strong enough to stay at one of our special care nurseries, our team of Cincinnati Children's pediatricians and physicians, neonatologists will care for your baby there as well. Our special care nurseries, as stated, are located at Soin Medical Center, Southview Medical Center, or Fort Hamilton, and our excellent bedside nurses provide continual updates and connection to your attending pediatrician or neonatologist. Babies in our special care nursery receive multidisciplinary care as well, which includes the physician, the bedside nurse, respiratory and developmental therapies. Our clinical pharmacist and dietitian are also available whenever needed. We thank you for letting us care for your baby and participate in their growth. Though having a baby that requires NICU or special care nursery would never be your plan, we hope that we can provide your family with the best care available. Thank you.
And I'm back, so you're all probably hoping this is another giveaway. Yes, it is. This giveaway is from Bella Baby, which is a newborn photography company, and they have provided a $100 gift card. Some of you will perhaps want a specialized photo session or your gift pack. So the question is, what did you learn about the nursery services that you didn't know before? One new thing. Type in your chat. And while you're typing, I want to add a little bit about the nurseries. On 3 of the 4 campuses, we have what's called single-family rooms. So this is the room for the baby to stay in with facility for the parent to be at the bedside. It's set up as a hospital room with all the medical equipment that we would need, but also a place for you to participate in your newborn's care as possible. So let's see if we've got an answer. Madison Hammerberg. All right. Congratulations, Madison. Our next speaker is going to speak about midwifery in our network. So I would like to have Jennifer Brannon come on up and share some details on midwifery.
Hi, I'm Jenny Brannon. I'm one of the certified nurse midwives with Advanced Women's Healthcare at SOIN. First of all, you might be asking, what is a midwife? A midwife, broken down the word, means with a woman. We provide personalized care to women throughout their reproductive lifespan. So not just when she's pregnant and having her baby, but throughout from menarche all the way to menopause. We are registered nurses with master's degrees and graduate level education. We are also nationally certified with the American Midwifery Certification Board. We manage low risk pregnancies and deliveries. We do co-manage higher risk pregnancies with our physicians. We deliver only at SOIN Medical Center. So at Advanced Women's Healthcare, we have 6 certified nurse midwives. We cover the call 24 hours a day over at SOIN for our patients. So we take a 24-hour call, each of us, 1 day a week, and then every 6th weekend. So what we do in our practice is we try to rotate women through all of the midwives during their visits, just so they can be familiar with one of us when they do come into labor at SOIN. We also help women with birth planning during their pregnancy. Birth planning can include anything such as the pain relief that they're expecting. And I always recommend that women keep an open mind at the very beginning of pregnancy, because you never know. You might do amazing without any kind of pain control, but then again, you might want an epidural. We can help you with any of that. Pain relief can vary from natural comfort measures, getting you up to the shower, laboring in a tub, on a birthing ball, just ambulating in the hallways, things like that. We offer nitrous oxide at SOIN Medical Center. It kind of takes the edge off contractions, and you can still move around the room and in the hallways. We also offer pain medicine in the IV, and of course epidurals are available to women as well. Other parts of birth planning would be skin to skin after the baby's born. Once the baby's born, we place the baby right on the mother's chest, and the baby stays there for quite a while. We do delayed cord clamping as well. We wait until the cord stops pulsating, which is usually a minute or 2, and then we clamp the cord and allow the partner to cut it, or the mom can cut it, whoever she designates as doing that. We deliver in women in various positions. It doesn't have to just be laying on their back with their feet in stirrups. Women who are not medicated With an epidural, they can deliver squatting, they can deliver on hands and knees on their side, however they're most comfortable. So we'll support them in that. We also help when women are pushing, especially if it's their first baby, they're going to push a little bit longer. So we will help with doing like a perineal massage to thin that tissue and help so it doesn't tear. So those are just some ideas for birth planning. You can look on the internet and get all kinds of ideas, and that's what I encourage my patients to do. Get some ideas, bring that into us, and then we'll kind of discuss it with you and tell you what your best options might be. But essentially, we're there to support women throughout their entire pregnancy and afterwards. And then also, something really exciting that we're getting ready to offer is supportive pregnancy care through the March of Dimes. What supportive pregnancy care is a group of women that are all due around the same time. They meet for their visits together, which is very exciting. It's led by one of the midwives. There's a topic of discussion at every visit, and we share advice and experiences, things like that. It's really nice for women to connect with other women that are due around the same time as well. There are private sections to that too. After the meeting of everyone towards the end, we kind of peel off individually, go into a private room, measure tummies, listen to baby's heartbeat, and answer any private questions you might have. So that's really exciting. In addition to that, we're still going to offer the traditional obstetrical care too, where you just meet one-on-one with a provider. So those are options, but we're really excited about offering that to women too. So that's about all I have today. If you're interested in any more information in midwifery care, then please feel free to call Advanced Women's Health Care, 937-429-7350. We do have offices that we see patients at Soin, Xenia, Troy, and Springfield. Thank you. Have a good day.
So before we move on with our next giveaway and speakers, we're going to have a little break so that you can stretch, use the restroom. So take about 5 minutes and then rejoin us so that we can continue on with all the information for you. Hello, welcome back. So our next drawing is from Usborne Books, and they have provided a $25 gift card for you. So here is your question. The last speaker was on the topic of midwifery. Can a woman who is in labor with a midwife have an epidural? Yes or no? So you have to be listening. Put that in the chat. Type in the chat, yes or no. First one with the right answer. We have people scanning the chat, so they know what's going on over there. Then they have to come give me the name.
Laura Sherman.
Laura Sherman. All right. And if you wanted to know, the answer is yes. Just a little tidbit there. Okay, so our next speaker is Michelle Beebe. You met her during the talk on childbirth education, and she is going to fill you in on how to get a maternity tour in the time of virtual touring.
Good afternoon again, everyone. For those of you just joining, I am Michelle Beebe. I'm the manager for perinatal outreach and childbirth education. And I get the privilege to meet people on Zoom. So I do tours every week for every campus on Zoom. We set these up by either calling my office or emailing us through the website. Our office number is, and I'll say it slowly, but I don't expect you'll remember it, 937-395-8600 or 513-867-2222. So, what is an online tour like? You don't get to physically look or touch. Well, guess what? We take you through the building using PowerPoint pictures and maps, and you talk with me. What we do, we start at the campus map, we show you where to park, we show you where to go, we show you what it looks like, and we talk about your questions. And so it's actually quite delightful. People have thought, oh no, I don't get to see something. And I tell you, well, at least we do an energy saving tour. We don't have to walk through the building. We can get from one place to another in just seconds. We stand around in different locations in the room where we wouldn't actually all fit on a tour. We get to all go in the bathroom at the same time together. Kind of fun. One of the highlights of Kettering Health Network is that all of our rooms are private for moms. You don't have to share a room with anybody. That's great. We have beautiful units. We have wonderful staff, and I love to share it with you, and I love to answer your questions. We don't just look at the unit, we also talk about your questions. I help families solve their problems. If they need to find Melody for help, I give you her number. If we need to set up a childbirth class, we handle that. If there's another private concern, I can set up a chat to talk with you personally. So it's one of the great things about the tours that we're customizing them. One of the challenges with COVID has been that every week the information changes. Sometimes it's been more than one time in a day. So the nice thing about the custom tours is that we can keep you up to date with what's happening that day and help you make plans. Also, if things change, you are welcome to reach back out and ask us questions. We love to answer your questions and we love to spend time with you. Thank you so much for allowing us to be part of this most sacred journey and time in your life. Thank you.
So we've come to the end of our afternoon together. A few other additional comments I'd like to make is you will receive a registration packet with other information in it, or reminding you of some of the information that we have already talked about today. I would like to thank you for participating in this virtual baby fair. This is the first time we've done it virtual. We've all learned new technology over the past year to be able to still connect with you. I would like to ask if you could put in the chat other types of speakers you'd like to hear. Are there topics that you'd like us to touch on for other virtual baby fairs? Please let us know what worked well, what you would like to also have in the future. So once again, on behalf of Kettering Health, I would like to thank you for joining us. We appreciate your time and hope to see you soon.